I do think one of the best safety nets you can give for yourself is tell your coaches, hey, I have an injured shoulder, and then they can help be your safety net, because we all will get in the gym and say,
I could do it. I could do this. Yeah,
I'm just going to do it anyways. And so
I've said that.
Welcome to Fitter Every Day, the show where we break fitness into bite-sized bits to help make you fitter every day. Today we have a very special guest. I'm actually the guest because this is the one of the few times that we have been traveling to a location. So we're here with Abbi and Aaron Rickelman. They are the owners and main care providers, two of the three main care providers at Design to Move Spine and Sport. Mm-hmm. Thank you guys for being on.
Yeah, great to have us.
It feels like we've known each other for 30 years. Even though it's not been that long.
Woody had hair when we met.
So we know each other because our office, their office and our gym, our Ankeny location are like catty corner to each other. But before that, before we moved to these new locations, you guys have been members at the gym for a while. So before we get to that, let's backstep a little bit, because I mentioned that you guys were chiropractors. Let's go Abbi first. Like, how did you get into chiropractic as an idea of like a field of doing stuff? And then we'll go to Aaron, because I think how you two meet is somewhere involved in this story. So how did you get into chiropractic generally?
I was really interested in medicine in general. And so I was kind of fiddling around with what I should do. So I went like, okay, maybe I should go to medical school. Maybe I'll go to dental school. My dad was an optometrist. I thought about that. But I was an athlete growing up. And so chiropractic was one of those things that just kind of naturally fell into that. And so I started going down that path. Went and shadowed a bunch of different chiropractors, and then could visit a few schools, and rest is history really there. So nothing super extravagant other than that. So,
yeah. Aaron, how did you get to where chiropractic became the option?
Similar to Abbi on things. It is absolutely the case that I always had an interest in medicine, and I've always, from an athletic perspective, tried to be athletic myself. Think that human movement is really stinking cool, what we can do. And all that to be said, my initial interest was dentistry. And just through working in that field, just wasn't my thing, if you will. I have a lot of understanding of it till this day. That understanding is very helpful, but just, it wasn't my thing at the end of the day. Too small of workspace, if you will.
Yes.
So that's where chiro came involved and became more interesting. I kind of did look at the PT side of it as well as the chiro side of it. And just, I think I had more of a following to the chiro side, which is interesting because in our practice, we're very PT heavy as well, right? So we blending exercise in with what we do. So at the end of the day, I'm still kind of doing everything that we had interest in to begin with. So
yeah. And one thing that I was going to get to this after a little bit, but that sort of makes a great segue into this. Chiropractic as a field, a lot of times, I speak from this coming from CrossFit as a side. We have Acceleration Eye, we have CrossFit. And Acceleration Eye, if you say we have a youth speed business, people are like, they kind of understand what that is, and they have they more or less right away go, that's a useful service.
Correct.
And then you say, I own a CrossFit gym, and people, there's like a 50-50 chance that someone's going to be like, oh, that's really cool. I know someone that does that, or I like that. Or there's a 50% chance being like, are you in a cult? Like, that's one of the things that's the option. And I feel like with chiropractic, you two have a similar thing. But I think what people don't understand is that chiropractic is not a monolith, in that there are a bunch of different types. And you guys mentioned you do a lot more physical therapy. So like, get into a little bit when you say that you're chiropractors and someone gives you the heebie-jeebies look, what is sort of your description on what that is?
Yeah, so just to be clear to start with, we can't actually, we're certified to be able to do physical therapy stuff, but we direct it from a rehab perspective because we're not physical therapists. So that's where we don't do a whole lot of post-surgical stuff. We don't do some of the specialty things that PTs do, and we do refer to PT for that in that situation. But if you come in with biomechanical low back pain or rotator cuff injury,
biomechanical back pain for the layman's terms.
Non-specific low back pain, or even specific low back pain that's referral of pain to an extremity, or neck pain to an extremity, right? So that's a referral pattern from the neck to the arm, or from the spine to the leg, or shoulder dysfunction, rotator cuff issues, meniscus and knee, things
basically
like that.
Pain that relates to the body in a musculoskeletal form and how the body moves, not necessarily like referral from an organ or something like that.
Yeah.
That's more like biomechanical type of injury, pain.
Yep.
So
we're a blend of, so chiropractic in and of itself is manipulation, right? So that's joint, putting movement through joints of the body. But the rehab side of it is a blend of soft tissue work, right? The muscle side of things, but then also movement around that to either build strength or build mobility, build conditioning around that. That's what we blend together to address our patient's concern, whatever that concern might be. If it's a shoulder for you, great. We're going to build not just mobility of the joint, but mobility of the tissue around that. So that's the blend of chiropractic and rehab together is what makes us different.
And I think it's funny you made that analogy because that's exactly what we get is we could say we're in chiropractic and we get the,
What are
really weirdo? Like, what are you doing? Like doing witchcraft or something? And then we get the,
We're not going to fix your
awesome, I love my
allergies."
chiropractor and blah, 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 whatever. So we get both sides of the equation. But even the person who may get the, oh, what? It's good because we bridge the gap a little bit. So we are very musculoskeletal in our approach. And so people understand physical therapy, even though like we can't legally say, oh yeah, we do physical therapy. Do we do a lot of what physical therapists do? Yes. Is there a lot that physical therapists do that we don't? Yes. But so people understand that a little bit more so we can help them understand like, yeah, we need to adjust you to get the joints moving, but we also need to work on the musculature, making sure that we don't have a lot of tension in some tissues, whatever that tissue may be. And we also need to strengthen it. If we don't have all of those components together, then our care is, it seems almost like we're missing something.
Yeah, it's limited.
Yeah, it's limited. And so not that just when you go to a chiropractor that just adjusts you, that's totally fine. There's just more added benefit by having these other things. So we add a little bit more length to our appointments for that reason, just because we do add in a lot of those other modalities. And the only way you can do that is just have a little bit more time with the patient. So.
Yeah, and you have a gym that's kind of in your facility. You have a gym. I mean, it's a fairly big for an office space gym. And when you guys come in, one of the things that I think you're the only banner that is hung up that's not ours in our gym, and that's because we do. If someone does, there's someone. We had a member who last summer was coaching softball for his daughter's softball team and then challenged some kids to a race around the bases and popped his ACL while he was doing that. Well, that sucks. But that person in managing to recover from that person was, I don't know if we referred them over there, or if it was just his decision to come over back and forth, but that type of injury from our perspective, because the way that we view everything is that movement is a fundamental portion of human life. Like,
Absolutely.
One of our director in Huxley, she was just mentioning that her grandma came to town. Her grandma's 88 or 93 or something like that, and had to be helped up out of a chair, had to be helped up to walk around, had to be helped up, or had to be helped to sit down. And like that is sort of the illustration of when movement isn't possible, life substantially deteriorates. And so for us, we're trying to make it so people can be as functional as long as they can. Well, we're working with people that are generally healthy. But then when you have something going on that takes you away from that full health, you want to be able to work with someone that understands and feels the same way that you do. So that's one of the things that as a gym and business that we have, we like to refer over to you guys because you do see things that way, which is we want to get you moving as fast as you can. Specifically with you two, what's interesting is that you guys are married. So this is a kind of a hard thing, but how does working with your spouse go? Because I mean, we can get back into the treating out. I just feel like we have to bring that up. How does owning a business and working with your spouse every day, how does that work?
So we'll
Still
circle.
married, so
Yeah,
I don't know. We're somehow figuring it out.
Yeah. Wouldn't have it any other way either. We'll circle back to one of your initial ones. We met in Chiro school within about the first 2 weeks, and legitimately, I think she walked by the first day of class because in professional school, your instructors move in and out of the classroom, and
like being in
you
school,
are you stay in one classroom. So they come and go, you stay there. All that to be said, she walked by the first day, and I'm like, oh, okay.
Hey, girl.
Hey, let's chase that down.
And I ran away.
And she did.
For several years.
Actually, it wasn't that long. When we started dating pretty soon after that, and one thing led to another, and here we are 9 years later. But to that question, right, I wouldn't have it any other way to work together. I love working with my spouse every day, but if we are in our clinical setting, our clinical day, right, realistically, we should not see each other that much. So at the end of the day, I still have to ask you, hey, how was your day? Type situation. Yeah, we work in the same building. We drive together in the same car to work, but not necessarily are we seeing each other, right? And so we have learned through our mentors, we stay in our lane, both of us, both in our home life and in our business life. We each are the CEO of certain departments, if you will. And in those departments, that person gets final say. So as an example, Abbi is involved in the books, the financials, the strategic planning on the financial side. A lot of community-based communication is all her department. And if an issue arises in her department, okay, we consult on it to each other, but at the end of the day, final decision comes from her, right? If we disagree on something. On the flip side, I deal with a lot of our staffing, our community outreach, so involvement in the community. Clinical operations are all in my department, and it's my final say type situation. But again, we consult, we bounce ideas off each other, and man, staying in our lane is just absolutely fantastic because it supports each other without nicking at each other with reference to creating tensions, right? Mm-hmm. So wouldn't have it any other way. Love it. I'm totally a cheese ball about it.
Yeah, you are. It's fine. He's the cheese ball of the two of us, but it helps too that we were in school together, and so we literally studied right next to each other for 3 years or whatever chiropractic school is, for 3 years straight. And so we didn't know anything different. So it's actually, I'm way further away from him now than when we were dating because we were just constantly in class together or studying together. But he is exactly right. We honestly don't see a lot of each other during the day, except for passing by his office and seeing he's frustrated. Then I might know, oh, okay, why were you frustrated today or whatever. But generally speaking, it worked out pretty well. I know it wouldn't work for every couple, but it's just kind of been the basis of our relationship, and we love it. So.
And it's wild too, because our staff is, we jokingly say we put the family in family practice, right? So with family dynamic, with the family dynamics, you're always going to have something, right? And one of our staff members, who's also a previous member at the gym, has asked us questions before regarding, hey, I need a decision from you guys on this. And we'll be bickering at each other like when no patients are here down the hallway, right? And she'll be like, no one gave me an answer. Can someone make an answer?
You guys are literally fighting through me, but not giving me an answer. Or you're like our child.
Yeah. So the staff makes it fun. They know the dynamics of it too. They actually feel like we're all big family here type deal.
So,
well, and I think another thing that's, at least from the outside in, it feels like you guys will sort of sort patients based on who, and you also have a third provider, Brady.
Yep.
And so it feels like you guys sort patients based on where your strengths and or comforts lie. So whenever I come in, because I get treated through you guys when I got something going wrong, and I get sorted to Aaron. I think I don't know if that's just a guy thing that you like to sort generally, or if it's just you had availability when I get done.
No, we all flipped a quarter.
No, I said he's going to Aaron.
No, I'm hard pass.
Who wants Woody? No one? No. We got to flip. We got rock, paper, scissors for this thing.
There's actually, I would say, not a huge difference. I've treated a bunch of males and females alike. The one difference is pregnancy. I will be the one that takes pregnant women, and generally speaking, kids. But kids kind of go back and forth as well. Mm-hmm. So it just kind of depends on situation there. So
okay. So speaking about pregnancy, that is one thing that I wanted to get in because you are really good as far as advising. So you've come in and given essentially a talk to us as a team on how to train those people that are either, doesn't really matter what phase of their pregnancy they're in, first, second, third trimester, or postpartum. I think now getting into more what you know as opposed to how you got here with pregnancy. So let's start kind of just early on and move through it a little bit. And Aaron, you can jump in at any point, but this is going to be probably
this is, you're going
to punt this one to your wife. Early on, that from our perspective, when we're one of the first few people that people tell that they're pregnant. Just generally speaking, because they need to let us know and they feel nervous that, am I okay to still do this? Because there's a lot of information out there, whether it's good or bad or old or irrelevant or new and whatever, where you should or shouldn't exercise. If someone comes into you and says that let's say they just found out they're 7 weeks pregnant, what is your advice to that person regarding physical activity? What movement restrictions, additions, what things are you going to try and modify to hopefully cut through the crap a little bit on what that is?
Yeah. Well, first of all, I would say, I know some women are just nervous to say something to a coach. And my hope would be that if a coach gets to know that someone's pregnant, they would keep it a secret. So that's the first thing, which obviously.
Yeah, mom's the word 100%.
And that's coming to. You guys always do great with that.
That's us and the staff, and we will communicate back and forth to the staff to make sure that everyone else there, but that is
which
our word only.
I've always appreciated you guys in that for sure. But just in general, I mean, I know coaches know that, but because I think it is a hard thing for women to open up about, because they're like, I haven't even told my mom and I'm going to tell you. So, but at first, very much so, I would say that work out like you normally do. Like there's going to be some restrictions I'll talk about here, but for the most part, I think women are like, I'm pregnant. I need to stop everything. I can't lift anything. I can't do anything. No, like you need to keep working out. Your body needs that. Your baby needs that. And it's one of the healthiest things you can do for that. And I'm not going to quote I'll tell you a study I've seen. I couldn't quote which one it is, but that they've shown a lot of benefit for a baby and the health and well-being of the baby and the weight regulation, stuff like that after, in like later on in a child's life when a mom has been active. So that's great benefit there. Anyways, back to the topic. Keep working out as you normally would, minus the fact that you are going to be growing a human. So there are things that are going to start changing. So I would start preparing for that. The biggest thing is midline flexion. So
midline flexion is like doing a sit-up.
Yep. Do anything, if you think about doing a sit-up and like anything that mimics that. So kipping movements are a classic one in CrossFit. I would avoid them. I don't think you're going to hurt the baby, but you're not going to do anything good for yourself. So if you start doing a lot of midline flexion, you will put yourself more susceptible to getting a diastasis. Diastasis, in layman's terms, is just when your abs start to kind of separate.
And what that kind of looks like for those that aren't sure what that is if you ever see someone, whether like they have sort of like a peak, and like if they got a six pack, but the middle part of their six pack is way farther out than the rest, and the ab muscles are sort of spread apart, that's what a diastasis is.
Exactly. And so,
and just to be clear on one thing, that common in pregnancy, but men can also get that as well.
Yeah.
Yeah, which is interesting. Men are like, oh, I can have that? Yes, you can. So, and so that's one of those things that the more you stay away from that type of flexion movement, the less likely that is to happen. So you want to think about keeping your core in one solid position. So not having a bunch of that sway back and forth, because that just makes you very susceptible to it. So at first, that's the biggest thing to remember. So no, I mean, even like handstand push-ups. If you want to do handstand push-ups, I would just keep them strict. If you can't, that's like,
sure. Just do some strict handstand push-ups. Go ahead, everybody.
For me, doing a strict handstand push-up just looks like I'm standing on my head, and that's it. So, but I mean, anything strict is great. Strict pull-ups, even like a banded pull-up, or you can do some ring rows, things like that. Once you start getting further along in pregnancy, well, let me back up. I would also stick to about 80% or less of your 1 rep max. There's no reason to max out. Your joints are getting looser, and so you're just putting yourself more susceptible to injury, trying to max something out. So,
and one other thing, I guess, that we often interact with is my job, generally speaking, when we do train a pregnant person, also to establish credibility. So Abby's done a lot of it's BirthFit instruction, actual specific education into training and dealing with people that are pregnant. So it's not just you pulling stuff out of your ass and saying, we should do this. It's a lot of education. But one of the things that my job, as soon as someone says, hey, I'm pregnant, or I think I might be pregnant, then my job most of the time is to put the brakes on you a lot. Because most of the time, people that are coming into the gym, they want to go, go, go. And one of the things that we also say, I think this is per you, is saying, let's keep your heart rate below like 85% of how fast you could be clicking. Let's not get you to 195, because that's a lot of pressure you're going to put on there. Still get your heart rate up, still exercise. But when you get to the point where you're like, I am exhausted, dying, we probably went too hard. So that's rolling that back a little bit.
Yeah, just checking yourself a little bit and realizing that you're growing a human. And so your goals are just different. Your goals aren't to continue, I want to get my deadlift 1 rep max when I'm pregnant. I mean, cool. It probably sounds cool, but just realizing your goals are different. Building a human, the goal is to be healthy. And so the other thing that I would say is that you really want to look at bar path. And so there's a transition point at when you start growing a belly, where you really want to look at bar path. So if your bar path is going to be altered, then you want to move to a dumbbell or just a different movement. So a lot of times when I would do, I've been pregnant twice, or I guess 3 times. You did have a miscarriage, but pregnant twice where I actually had to deal with the belly. When I would do a snatch, like you start pulling towards your chin, and your belly's gonna be in the way. And so
other things.
Yes, lots of things.
We're pregnant.
So you really just switching to a dumbbell and doing dumbbell snatches. Or there's times I'm like, you know what? I want to just do like an overhead squat. So I started it from the rack, put it on my back, put it up an overhead squat, and I was able to do that instead. So just being able to modify some little things around like that, and realizing that just because you're not doing the exact same workout doesn't mean you're not getting a good workout. So that's the main things is making sure that if your bar path is starting to get altered, change the movement up altogether, or just move to a dumbbell. There's also a point at which, unless you are a crazy like runner and just run all the time, you're probably going to get to a point where running is not going to feel so great. When that point comes, then you just move to a bike or row, that type of thing. Some women are able to do double unders and things like that their whole pregnancy, as long as you're not leaking, and you're not feeling like pressure, low pressure, you're fine. I was able to double under through my pregnancy with both of my kiddos and had no problem. But it's different. But I couldn't double under after. So because I was leaking and things like that. So I had a lot of pelvic floor work to kind of do, rehab wise around that. So transitioning more into the postpartum stage.
I got one question during the kind of the while a woman's pregnant.
Yeah.
I'm not sure if you guys would be able to have an answer to this, but there's a common misconception, and usually it's this random arbitrary 20 pounds thing where don't lift over 20 pounds. Well, first off, do you know where that comes from? And then 2, that seems to be incorrect. Why is that incorrect?
I have no idea where that comes from. I don't know if it was just some old thing that was said and just is passed down for whatever reason.
I guess strenuous activity is going to push something, sort of.
That's the only thing I can think of, is that they're thinking strenuous activity is going to compress down the baby, and that could potentially create some sort of issue.
The caveat to that also would be the fact of, if you were not an active person prior to pregnancy and then becoming an active person while you were pregnant, I could see some more limitations on movement patterns and all that nature, right? But on the flip side, if you were highly active ahead of time, I don't understand why that disposition is there.
And there's an explanation, at least that I've used and communicated to some clients that have done that, is your body is used to operating with this set of hormones. And exercise, we all know, it controls hormones in a really, really strong way. And so your body at exercise is used to controlling these hormones in this way with this exercise level. If you stop that, if you didn't have a kid and you just altogether stopped that, your hormones would be all over the place, because your body, that what it normally likes to operate at, isn't there anymore. And you're now growing a kid. So your hormones are going to be way all over the place, and it's going to be a lot rougher than being able to try and maintain more or less the same activity level, because that's what your body wants to and is in the groove of doing. So that's one thing as far as accuracy. But yeah, as far as the weightlifting, you're saying that it is generally, most people, most situations, most circumstances, most, it is okay.
Absolutely. I mean, I think if you are already working out, lifting, things like that, no problem at all. I mean, I stayed under my 80% 1 rep max, and I lifted it until the day before my son and daughter were born. No problem at all. So what are you laughing about?
Real specifically on our son, because boy, we were at the gym on Saturday morning and you delivered him Monday morning, but
it was to the hospital that weekend.
Yeah, it was that weekend.
Yeah. So, I mean, CrossFit is a beautiful thing for when you are pregnant, because it mimics labor. Think about an EMOM, every minute on the minute. Well, contractions, unless you're me with my daughter, I had 2-minute contractions for whatever reason. That was fun. But about minute-long contractions. So you're practicing essentially what labor is.
The intensity in that 1 minute.
Your intensity for a minute, and then you can back off. And then intensity for a minute, and you can back off. And so it's this beautiful thing that like I was mentally ready for it. Birth is a mental game. And so if you can be mentally ready for it, CrossFit is really a great practice session for what labor is. So,
which is also not a terrific sales point for anybody that's considering it. It's just like labor. It's better than that, I promise.
valid. Okay, fair point.
All that to be said, though, too, from even the husband's perspective, it is, I mean, through CrossFit workouts, you're used to explosion, contraction, relaxation based upon whatever the movement pattern is, right? Or whatever's called for in the workout that day. Labor is not much different than that because you're going to hit a peak moment during your contractile period where everything's tightening down, but then you learn also how to fully relax in the times that it's not. In working through the mental stress, I mean, we've all finished a CrossFit workout and laid on the floor like, wow, what did we just do? Albeit high five, see you tomorrow, we'll do the same thing again. But it is that mental game and teaching the human body through workout to then mimic what labor and delivery is with reference to that explosion, contraction, relaxation is fantastic at preparing the female body to do a either non-medication driven or even a medication driven vaginal delivery. I mean, C-sections need to be needed. There's a reason for that and a place for that based upon medical circumstance. But at the end of the day, the body is prepared and the musculature is prepared because you're already working out.
We've had the baby now. What are the things we got to consider, assuming that it's a traditional vaginal birth?
Yeah. I mean, and even C-section, you just have a longer wait period really to get into things until we're cleared from your doctor. But postpartum, I was shamed for it, I think, a little bit. But I started about 2 to 3 weeks not doing CrossFit, but moving. And so I needed to move. And so I would do just simple things. And I would come to the gym just because I liked community. That's a beautiful thing about CrossFit. And I would just do some air squats, or I might, step over the top of a box, that type of thing. It was nothing strenuous, but you can get to moving, and moving is beautiful for the body. It's beautiful for healing. I was lucky enough not to tear. So I was able to kind of do some of those light things at about that time. But beyond that, it's very similar to pregnancy. So again, you want to avoid anything that's creating a peaking or that diastasis movement. So you don't want to be doing a ton of flexion movements right away until that healing starts to take place where you're not seeing that.
Because you just had a bowling ball underneath your abdomen.
You did.
That still has to settle back together.
It does.
And your organs moved out of place too, or not out of place, but moved in direction to that hollow space, right? I mean, that's a common statement a lot of females feel is I feel empty in there now. Well, everything's kind of moving back.
Mm-hmm.
So, I mean, it's about being smart with your movement and slow into it. I loved moving, but it was not like I was throwing a barbell in my hands. Actually, funny story. I was actually like probably 3 weeks postpartum. And I thought, I wonder if it's just, I'm going to just took an empty barbell. Don't do this. Don't do this. So I picked up the barbell. I'm like, empty barbell. I'm like, let's just do a snatch. Yeah, too soon. So I tried it for you. Don't do it. Anyways, that was dumb. I know better than that. But I was like, man, I feel like you just walk into a gym and you're just like, I got to touch a barbell. Just if you feel that way, just don't go into the gym.
Just wait. Just wait a little bit.
Wait. It was dumb. But I thought I'd be transparent and that I'm dumb. So anyways, moving back, it's literally everybody is different. And so if you tore, that's a different story. If you didn't tear, that's the different story. But you want to move when it feels good. To start moving, and getting into the barbell or the weights is all about when that diastasis starts to heal. And at 6 weeks, a lot of times people are cleared, and I would still just because the doctor says you're cleared, I do think there needs to be like this settling in period a little bit, where there's some guided movement. And that's what coaches can be good for, is they can look for that type of stuff. If a woman is doing like a little crunch, that's a great way to look for it. And there's a big space that you're seeing, and there's like this big peak that's happening, then they're not quite ready to be doing some kipping motions and stuff like that. I've seen women though that are rock stars for whatever reason, their core heals up really fast and they're able to do that really quickly. So it just kind of depends on the person. And that is the biggest thing to watch for, and the biggest thing you want to heal when after postpartum wise. And then there's the peeing. Every woman wants to know about the peeing, right? So again, you want to stay away from things that make you do that all the time, because then you're just perpetuating the problem.
Which those things for people that haven't had a kid yet or haven't really had that problem, it's usually really high strenuous things like bracing, deadlifts, snatches,
Pressure.
Olympic pressure, also
Double unders.
jumping and bouncing, like running and jumping, like double unders or hopping over the barbell or something like that. That stuff just generally is going to be the pressure that's going to cause stuff like that. So anyway,
Correct.
Which the funny side story of this is the fact that back when it was a predominantly male-owned gym early in its stages, I think there was a conversation had between Abbi and Sean and Woody about, hey, you might want to let the girls go potty before double under day.
And if you are one of those women, I would highly suggest, I don't care if you had a baby yesterday or if you had a baby 20 years ago, if you are leaking, there's a lot of stuff that can be done for that. We do some in our office, but I would highly recommend going to like pelvic floor PT, that they can do a lot of internal work. Not my jam. I don't do that. I can do a lot of the exercises and things like that, but there's a lot of times there's just some more stuff that I don't dabble into that people who are pelvic floor PTs do, and I would highly suggest it because it's typical, it's not normal. So, yeah.
So one thing that's interesting now, transitioning out of the maternity, pre and postpartum, it's funny that because you're talking about CrossFitters and you're talking about people that are pre and postpartum and you're talking about people that have movement restrictions, and that sort of seems like, oh, well, you guys only treat then people that are pregnant. We're like, well, that's not necessarily the case. Like you guys, the spectrum that you guys treat is from fresh off the couch, have never moved before, my back is killing me, to professional athletes. First off, just generally speaking, let's go from like the spectrum of people. How do you approach a patient if they come in and they are really high level versus kind of base? Like, what's the assessment to kind of understand where they are? Because I'd imagine every person's a person. You just individually should come up with a treatment plan. But like when you're assessing someone and you get that little questionnaire and they're like, I haven't exercised in 10 years. Like, what is so go back to Aaron, because I'm gonna tag out Abbi for a sec. So when you're assessing someone and you see that someone hasn't exercised, what are your initial thoughts when you're going to change that? And then we'll get kind of up the chain of athletic experience.
So I may accelerate that on you just a little bit because it's meeting a patient where they're at, right? It's meeting the biomechanics of where they're at, biomechanics, the movement, what they're used to, right? Where if they haven't exercised in 10 years, great. What we're going to do to change your pain pattern is probably something that's going to make you sore really quickly, right? Because I'm going to have you do something that you may not be used to, or based upon age, if you're maybe 70 and not necessarily as mobile as you were when you were 50, right? We're going to do, through that assessment, we're going to be figuring out how do you need to move better. And I don't mean global movement. I'm talking about movement to change your pain. Okay. So meeting the patient where they're at, I think is key to that. And that's at all levels. So that's from the 70-year-old grandmother to the 19-year-old pro athlete type situation. Meeting them where they're at. And the assessment starts with, okay, let's figure out the pain pattern. Let's figure out the diagnosis. And then let's figure out how we're going to move to work with that. And that is where the intricacy of understanding the dynamics of the person becomes different, right? So if you don't have any range of motion because you're older, we're going to work that range of motion to change your pain pattern. On the flip side, if you are a 18-year-old football player, your range of motion is already globally larger than someone who's 40, for instance. So it's meeting them where they're at to change that pain pattern repetitively is kind of the goal. I feel like there's something you want to add to that.
I mean, the interesting thing about treating someone who's 18 versus 90 who just is trying to stand off the couch, or someone who's never moved in their life, it's actually interestingly the same. So a squat is a squat. You can squat with 400 pounds on your back, or you can squat to get out of a chair. Actually, the initial portions of treatment are very similar.
Very similar.
Because all we're trying to do is get the tissue, the injury to heal. And so that's very similar in how a treatment happens. We are working on soft tissues and things like that. And then we're going to be getting into some exercises to stabilize around that. All those look very similar. Those exercises may be a little bit different per someone's ability. And then where it starts to, that divergence starts to happen between like someone like a professional athlete, like someone like Mal, for example, Mallory O'Brien, who is a rock star, right, in CrossFit. And then you've got someone who's, like you said, just got off the couch. The difference between those two people is you have Mal, you're going to be throwing her into a bunch of different movements that are similar to exercise that she's doing on the daily basis. So it's just a little bit more intense in how the rehab looks. It's return to play rehab, whereas someone who's just gotten off a couch, their return to play is, can you squat out of the couch?
Can you get up off the couch by yourself?
And so it's very similar until that type of stuff starts to happen, because you have to really start to test their tissue in a more intense way. So,
and that's where I think there's two phases of care. It's pain reduction is stage one, and stage two is return to function. The return to function stage is exactly what Abby's referring to, on meeting them where they're at athletically with the associated exercise or demonstration or mobility pattern that matches where their skill set is already at, and then amplifies that as we go. So to break that down more specifically, I think it's more difficult because it's on a case-by-case basis, right? If it's a shoulder issue, that's going to look differently than a spine issue would. Make sense? But on the flip side, it's understanding where they are, where they in an injury, where they were pre-injury, what their goals are after the injury. Because if their goal is just to get up and down off the couch, great, let's work on the mechanics to do that. If it's to, all right, you're not picking up a 400-pound deadlift again for a little bit, let's get back to the 400-pound deadlift when we're ready.
Yeah. So one other thing is, like, you mentioned Mal O'Brien, like that's not just like a hypothetical so that is actually, you guys are on the treatment team for Mal O'Brien. I think people would just be interested to know, how did that come about? I mean, without releasing too many personal details, how did that come about where you ended up treating potentially the fittest woman on earth?
She lives in the area, so, I mean, we just looked that cool, I guess. No, I mean, we'd known EZ, and she was working with EZ at the time.
Elijah Muhammad.
Elijah Muhammad. And so that's kind of how that just kind of trickled down. So, yeah. Yeah,
it goes back to the community, right? CrossFit is a huge community, and, knowing the coaches that know the athletes that are, I can make this recommendation, you have had this injury, right? Hey, let's go see these guys because they have that CrossFit understanding. I think that's where things started to occur. And with any athlete of any age, doesn't matter if it's a high school football player. I mean, Woody, you played for Iowa State. You had injuries yourself. Everybody is prone to something at some point. So it was building a relationship back in the early stages of her career, and then meeting her where she was at each time as she advanced through her career, by all means. So it's with any pro athlete, and we do have several here in the office, it is absolutely the case of, all right, how do we start from here, and where do we go to? What's the restriction? Where's the goal? What's the next goal?
Yeah, and your performance, just getting off the couch, like your performance needs to be good. So the stakes are just a little bit higher.
Stakes are a little bit higher.
Yeah.
Yep. So, I mean, I love treating athletes at that level. I also love treating the average Joe, just because the dynamics of each of that are similarly different. Right. That makes sense.
A professional athlete literally knows, like, I can move in this centimeter of a range of motion, and that's where it bothers me. Where the average Joe has no clue that
my shoulder hurts. What are you doing? What are you doing to make it hurt? I mean, it just hurts. All right. Appreciate the help.
Yeah.
I slept on my side. I woke up this morning. It hurts.
Yeah. So, yeah, it's just a different dynamic of it's a little bit more of a fine tuning with that type of level of athlete. So,
okay. I got one last question. So you guys do treat people who are just coming off of an injury, but also people that are just kind of regular everyday Joes. When you guys see people, whether they're CrossFitters or athletes or whatever, I imagine there's no, like, you, again, HIPAA, you're not protected, like you don't have to release any personal information, but the injuries that you get, because at least for me, so let me clarify where this question is going. When I personally, the two injuries that I have had to come in to see you guys for have been sleeping wrong and sleeping wrong. That's it. That's two. And so I'm a belly sleeper, and one of the times my wrist was bothering me because I fell asleep with it folded. So like my palm was almost touching my forearm. And then I came in and woke up, it's like, wow, my wrist hurts. And then a little bit later, still a belly sleeper, my arm is above my head. I turned a little bit too far, pulled some type of muscle in my shoulder. So
There's a third injury.
there's a third. Well, there was one doing. That one actually was like a low back injury doing deadlift. So there's 3. But for the perception that CrossFit hurts people, how do you guys, when you receive people that have injuries, the nature of injuries has to be all over the place, right? Is there kind of you say, all right, you're a CrossFitter. Let's see here's a tendency where your injuries could be, or if it's you did what? Hurt yourself how? So like what is your perception of what the injuries look like when someone comes to you?
Are you saying it's CrossFit?
I was going to say,
more or less.
where are you?
More or less. CrossFitters being injured is inherently a myth. But when CrossFitters come to you, do you guys see that as a myth, or do you see that as, okay, this is actually fairly dangerous?
No,
go
ahead.
I see it as a myth, but also a truth when people do dumb things.
Okay.
So I think CrossFit's amazing. It allows the body to have some stability that there's a lot of other ways to exercise that do not provide that. And it's functional movement on steroids. Like, it is great movement. However, people also need to learn to check their pride. And so at the door, including myself sometimes, like lifting a barbell when you shouldn't, like that was dumb. But like, you need to learn to check your pride at the door. And so there's times where you may have been injured because you slept wrong. Well, that also is probably going to inhibit some things in the gym now that you are injured. And so, pulled something in your shoulder because you slept wrong. Well, maybe we shouldn't do handstand push-ups right now. That doesn't mean forever. That just means right now. And so I think that there's some truth to it when we just don't scale it back when we need to, because we as humans are prideful. And I think that's where a lot of it comes in. And I do think one of the best safety nets you can give for yourself is tell your coaches, hey, I have an injured shoulder, and then they can help be your safety net, because we all will get in the gym and say, I'm just going to do it anyways.
I can do this.
I'm
It's
just going to
fine.
do it anyways. And so
I've said that.
there is one movement I will say is inherently bad: handstand push-ups.
Oh, 100%.
The neck is just not a weight-bearing joint. I love handstand push-ups. They're so fun. They're so fun. I personally stopped doing them because I literally kept injuring myself. And so, but they're so fun. And if you can tolerate it, great. Like, I just think you might have some issues eventually just because there's not weight-bearing joint. That's the only movement that I'd be like, yeah, I mean, I can see how we can have some problems. But
I don't think anything in CrossFit predisposes you to additional injuries, albeit I do think there's movements in CrossFit that if you come in and say, I have a shoulder injury, and I ask, how did it happen? And you said doing pull-ups, I'm going to be like, not shocked. Does that make sense? Because it's either you had a predisposition prior to that, a form mechanical problem, which we all have in some disposition. We're all not perfect. It wasn't the pull-up itself. Yeah, that's what caused it. And it wasn't CrossFit that caused it. It was something went wrong within your movement pattern or within your tendon or within, hey, the other 8 hours of the day, you're sitting at a desk, hunched over, crunching out on a keyboard, and you're not moving the rest of the time. That's not helping you be more mobile throughout your day. So it's not CrossFit that creates the problem. It's all the other factors in your 23 hours of the day that create compensation patterns that result in things showing up at CrossFit gyms that result in injuries.
And then when something happens, we send everybody over to you guys.
there you go. Just keep doing it. I'm just kidding. But no, and I do think sometimes CrossFit gets a bad rap for whatever reason, but at the same time, people get injured at gyms in general all the time. But I've told people all the time, I'd rather you have an injured shoulder or an injured knee or whatever that is injured than your heart not work well. Your heart is one thing that is harder to get rehabbed than it is your knee or whatever. So keep moving, and sometimes things are going to happen. Like if you work out, injuries are going to happen. Also, if you don't ever move, worse injuries are going to happen, honestly. So, yeah.
People who are marathon runners may need knee replacements. People who are unfortunately wheelchair bound might need a knee replacement. And those are two extremes on each end of the spectrum. And it isn't because of the load characteristics of being a marathon runner. It's simple joint deterioration. It's just a matter of how it happened type situation. And not saying that everybody's going to need a knee replacement, just using that as an example of, I would rather personally for my own health work out and put life in the end of my years. So continue to add years to my life because of working out and have the aches and pains versus I'm going to sit here and eat bonbons and watch TV the rest of my life and die of a heart attack at 58.
I mean, bonbons are good.
Bonbons are fantastic.
Let's do some more squats and eat bonbons.
All right. I think we've exhausted at least enough of your time because you guys have to go, see patients and be business owners and parents and whatever. Anyway, so thank you guys for letting us stop in and talk to you for a little bit.
Thanks for having us.
Thanks for having us.
All right. Thanks, everybody.